Welcome to the Is Health Podcast, where we explore anatomy, chemistry, energy, and soul to reclaim health with truth, science, and wisdom. I'm Dr. J.D. Young. You may have seen the headlines suggesting that taking Tylenol, also called acetaminophen, during pregnancy could be linked to autism. Some public figures, including U.S. Health and Human Services Secretary Robert Kennedy Jr., have voiced concern. Others, including WHO and the European medicine agencies, emphasize that the evidence for the causal link is inconsistent. Well, we have to pay attention to the word. Causal link means one causes the other. It is very hard to establish. We'll discuss that later because autism is indeed multifactorial. But there might be association. That's enough to raise the concern. It does not have to be a causal link. If there is association between a medication and autism, we need to talk about it. As far as whether it's consistent or inconsistent, it's a study, but for individual patients, if that happens, that is very consistent to that individual. So in the clinical setting, we care about one person at a time, not the statistics. Today, I would like to look beyond the debate and focus on what matters most, you and your unique health journey. Scientific studies on acetaminophen and autism are mixed. Actually, it's true for majority of meta-analysis of all kinds of studies, because everybody uses different methodology, different size, different audience, of course, different statistic choices, and they all have a mixed results. So if you want to look at the meta-analysis, very often the results is inconclusive. Some studies suggest association, which are more likely to be true, while larger family-based studies, especially those comparing siblings, find no clear causal effects. Let's pay attention to the words causal. Nobody can really establish a causal effect. But association is very important for us to recognize. This kind of conflicts doesn't mean anyone is wrong. It shows how complex pregnancy, brain development, and autism really are. The ACEs model helps us step away from single cause thinking. Anatomy, how baby's brain and the body are built uniquely. Chemistry, nutrients, hormones, inflammation, and yes, medications like Tylenol all play roles. Energetically, emotional health, stress, sleep, environment, and the electromagnetic field have a huge impact on the developing brain of the baby. So, of course, purpose, resilience, relationships of deep meaning that shapes how families respond to health challenges, how mom entering pregnancy and how the mom handle the pregnancy and the birth all have a lot to do with the consequences of baby's health. Autism arises from many overlapping influences: genetics, epigenetics, environment, and life experiences. A single medication may contribute, but rarely can explain the whole picture. Still, recognize that association is extremely important and informative for the people to consider to start family. Epigenetics show us that the gene can be turned on or off by environment, things like maternal stress, nutrition, infection, or some medicines. Tylenol might contribute under certain conditions, but it's hard to establish it is causing autism. It may facilitate or contribute to the development of autism. Larger studies show that the family background, health conditions, and lifestyle strongly shape outcomes. That means every pregnancy is unique. What matters most is understanding and supporting your own risk profile. At ACEs, we encourage informed decision-making. Talk with your doctor if you need pen or fever relief, weigh benefits and risk for your body. Use medications sparingly and wisely. If there is a natural alternative, try that first. If medication is absolutely needed, pick lowest effective dosage for shortest time. Support your chemistry with nutrition, omega-3, folic acid, in some cases, antioxidants. Care for your energy and soul, stress reduction, emotional well-being, having purpose and family support all shape both maternal and child health. It is not about blame or fear. It's about empowerment and balance. The Tylenol autism conversation is a reminder that health isn't simple cause and effect. It's personal, multidimensional, and deeply individual. Whether you are pregnant, planning, or supporting someone who is, stay informed, seek personalized care, use natural therapy as much as possible, and consider the whole picture: your body structure, your biochemistry, your energy, and your soul. If this episode brought clarity, please subscribe and share ACES Health Podcast. Together, we can build a more compassionate, thoughtful, and wise approach to health.